Good evening, students. Now, continuing with our lecture series, today I am going to talk to you about prostate, benign prostatic hyperplasia. Meaning that why benign prostatic hyperplasia is a normal age-related phenomena in which there is a hypertrophy or enlargement of the prostate gland. That's why we call it benign prostatic hyperplasia. So today I am going to discuss with you only, anatomical considerations of prostate and bladder outlet obstruction, the pathology of prostatic enlargement, and clinical features, etc. And then further in lecture 2, 3, I'll discuss with you investigations and the management. Now here you see the location of the prostate. The prostate gland is the size of the chestnut or walnut. Here you find this is the prostate gland. This one is the prostate gland which surrounds the prostatic urethra. The prostatic urethra starts from the bladder neck and is about 20 centimeters long in males. Now you see this is the prostate gland and this is the prostatic urethra, and this is the urinary bladder here. And here you find this is the kidney, renal pelvis, this is the ureter, and there is a ureteric orifice on this side. Another ureteric orifice is on this side. This portion is called the trigone of the bladder. This portion is called the triangular structure, is called the trigone of the bladder, and there is the internal sphincter. The internal sphincter lies at the bladder neck, and there is the external sphincter, which is striated muscle, which is voluntary. When a male wants to pass urine, he can control it, but internal sphincter is not under the control, voluntary control. Okay, when a person wants to pass urine, this internal sphincter relaxes, and person with external sphincter, which is lying at the junction of the prostatic urethra and the membranous urethra, between the prostate and the membranous urethra, you find the external sphincter. Now briefly I wanted to tell you about the anatomy of the prostate, that it is walnut sized, it has got a prostatic urethra, and there is a verumontanum inside, which has not been shown here. Verumontanum, and which tells us the limit up to which we can do the transurethral resection of the prostate. The viru has got a what prostatic urethra has got a verumontanum in the center, the prostatic uretricle, and the openings of the glands of the prostate, the ducts, they open into the prostatic urethra. Now here you see when the prostate enlarges, by the age of 60 years, 50% of the people, they have got prostatic enlargement. When this prostate here, you see this is the prostate here. So I'll show you. This prostate, when it enlarges, it causes bladder neck obstruction. Okay. This is the bladder neck. When the prostate enlarges, the urethra is not compressed exactly, but it's lengthened and it becomes tortuous. There is an increase in posterior curvature. This is the AP view, and there is a tortuosity there is a increase in curvature of the urethra here. And as the prostate enlarges, sometimes because there is an increased strain of tone of the internal sphincter, and because of difficulty in passing urine, there is a bladder outlet obstruction. As a result, subsequently the bladder wall, urinary bladder wall, hypertrophies, and you find once it hypertrophies because of bladder outlet obstruction, the muscle bundles, they become visible because of the hypertrophy, and this phenomenon is called trabeculation. And between the trabecules you find saccules. Now these saccules become the weak point, and sometimes you find that due to increased pressure, the mucosa protrudes out, and these are called diverticula. So there is a trabeculation due to bladder outlet obstruction, increase in pressure inside, and there is a sacculation, and there is a diverticulosis. Once the diverticulum is formed, it contains urine, stasis, and it may become infected, and there is a stone formation. Now because of this bladder outlet obstruction, there may be reflux of urine into the ureter, which is again a source of infection, and bladder outlet obstruction may cause hydroureter and hydronephrosis, where you find the dilatation of the pelvis and the calyces, a dreadful complication. Patient may go into renal failure or something like that, and there is a bilateral involvement. So with these words, let me tell you, I'll focus on the anatomy. Now here you see another picture of the prostate. Now this is the prostate gland, there is the bladder neck here, there is the internal sphincter, and these are the seminal vesicles, and you find the ejaculatory duct which crosses through the prostate and opens into the prostatic urethra. Now above the prostate ejaculatory ducts, you find this is called the central zone, and the prostate has various zones. One is the central zone, this one, which lies posterior to the prostatic urethra, and there is a periurethral transition zone here. This is the space, this is the part where from the enlargement of the prostate starts and it compresses the prostatic tissue. This is the peripheral zone which lies posteriorly. So this part of the gland, the what you call the posterior zone, due to enlargement of the prostate, which starts in the periurethral transition zone, this is compressed and it makes a fibrous false capsule outside. And outside the fibrous capsule, because the peripheral zone is compressed because of the enlargement of the periurethral transition zone, and this compressed tissue makes a fibrous capsule, and outside that there is an anatomical fibrous capsule, and between this is surrounded by endopelvic fascia, and posteriorly this condensation of pelvic fascia is continuous with the denon-vilus fascia, which separates the prostate gland posteriorly from the rectum, because in front of the rectum you find there is a prostate and there is a tough facial layer, denon-vilus fascia. Okay, and you find as you come here there would be external sphincter, which is thoroughly under the control of human beings. All right. Now here you find another section. This is the prostatic urethra, which is surrounded by urethral glands. The opening of the urethral glands will open into the prostatic urethra, and this is the submucous gland, which is called adenomatous zone. It is again a glands, and the ducts open into the prostatic urethra. Okay, and this is the carcinomatous zone. Here these are the glands here, and this is notorious for causing carcinoma of the prostate. Okay.